Okay, let's look at some microanatomy. Okay, this is a lymph node. And you can tell it's a lymph node because it has a somewhat of a subcapsular space. The thal cells just below this capsule thinned out, all that, the subcapsular space. This is unique histological slide because you're actually seeing right here an afferent lymph vessel coming in. So out here, these lines out here are trabecular, okay? Other than that, you can't see much of anything else except all of these cells right here, white blood cells. I don't see a real good germinal center in this image. This out here is skeletal muscle cut on cross section. And you have dense irregular connective tissue. This is the same slide as the previous, but we just moved toward the medulla. You can have some more trabeculae or sinusoidal capillaries. It could be either or. There can be a lot of sinusoidal capillaries in the medulla. This looks like an artery. Here's another artery cut across section. This one's cut kind of longitudinally. The T cells are hanging out here. Your naive T cells. So what's a naive T cell? A T cell that has never been activated. Okay. So its receptor, or that T cell, has never seen a foreign invader of which its receptor is designed to bind to. So therefore it's naive. Okay. This is the hilus. This looks like an artery. And I don't know what these arrows are pointing to really. But yeah, the red arrow is definitely an artery. The rest of this could be just about anything else. But anyway, there's supposed to be efferent lymphatic vessel coming out. This might be it right here. This is a lymph node, but this is really, really different. It's unique because there is an artery in the center of this germinal center, or near the center. And you never see this in a lymph node. This is probably an accident. You only see central arteries in the spleen. That's definitely an artery in the germinal center. Here is the subcapsular space. Okay, here is a vein with little red blood cells in it. Here is an artery, kind of like cut cross or longitudinally. Here's another artery. Okay, this is another example of lymph nodes, and we have trabeculae, germinal center, germinal center, germinal center, the capsule, or what might be the subcapsular space. Of course, these are high power magnifications. This is in low power. Here are two slides demonstrating valves in the lymphatics. This is a valve, and this is a valve, cut from slightly different perspectives. And this is the tissue you see that's described in AMP1 as areolar connective tissue. Okay. This is a central artery right there, surrounded by the germinal center. And all this stuff out here is white pulp, at least most of it. And there's some red pulp here. This is the same thing, but they use a different stain. This stain is kind of like a bluish purplish, and this is dark, almost black stain. Central artery, germinal center, red pulp, white pulp. And again, it's not white because of the stain. The capsule on the spleen is really thick. This will be a trabeculae coming in from the invaginating capsule, And this right here is probably, looks red, so I'm going to call it red pulp. Sinusoidal capillaries of the red pulp. Here is a germinal center, and if you look really, really close, there is a small central. Central arteries are always in the germinal center of the spleen. Here's another central artery, here's the white pulp, red pulp here. And again, these are 2, maybe 3 different slides utilizing different stains, and that's why they're different colors. So you look at the morphology, you don't look at the color. Okay, now this is different. This is definitely a germinal center. B cells in here, outside here will be some T cells. And at this magnification, I really can't tell what I'm in. I don't know that that's a capsule or what it is. And I'm saying that because tonsils are histological lookalikes. But just looking at this, I can't tell if your tonsils being this magnification because they look alike. Here are some sinusoidal capillaries up here, toward the medulla. And then we look at it under high power, and lo and behold, this is the same slide as the previous. Lo and behold, it's not a capsule, it's non-keratinoid stratified squamous epithelium, so you're a tonsil. And we look at this same slide, and we look at the hilus of the slide, and guess what we find here? Salivary glands. So you're definitely in your mouth. Okay, salivary glands at the hilus. I mean, let's face it, you don't want salivary glands in your armpit, right? The tonsils. Okay, not a very good place to salivate. Even though you sweat there, I mean, you don't want saliva running down. So you're going to have salivary glands associated with tonsils. This looks like a huge vein right there. And I don't know what this hole is right there. So this is different. Again, you have lobules, a very thin capsule, the cortex and medulla, and elsewhere you have these things right here called Hassel's corpuscles, so we're definitely thymus. Only in the thymus are you going to have Hassel's corpuscles. And only in the thymus are you going to be lobulated like this. Okay? This is probably a young adult because it's generating Hassel's corpuscles. And we don't know what the heck Hassel's corpuscles are or what they're doing. Okay? It may be part of the tissue starting to die, who knows? This is the thymus. And there's a lot of tissue, so this is probably a young adult as depicted by the Hassel's corpuscles. Hassel's corpuscles are ugly, weird, and depending upon what stage they are in their development, they look different. You will not see Hassel's corpuscles in infant thymus. Won't be there. Or the same thing. Is that the same? No, it's different. They're just downright ugly. Okay, weird. This is, let's see, this up here looks like probably the stomach, because that's the mucosa here, stomach mucosa, and this in the submucosa, this is mucosa. Mucosa again is the epithelia cells lining your digestive tract. And in the submucosa, you have a diffuse lymphatic tissue right there. It's starting to generate. It's either just cutting the edge of one or it's starting to get started. So this is your gulped malt or Peyer's patch. Here's another one, and I can tell where we're at on this one because this is the duodenum. And the duodenum, only in the duodenum you have these Brunner's glands. Here is a diffuse lymphatic tissue. And you can tell this is duodenum because Brunner's glands gives rise to ducts that dump a secretion into the lumen of the duodenum. So the lumen will be way up there toward the ceiling. And this is the mucosa cells, which will be simple columnar epithelium. This would be your submucosa. Brunner's glands are submucosal glands. And we'll talk about Brunner's glands when we get into the digestive tract, because all we're really concerned with here is the diffuse lymphatic tissue, malt, gullet, or Peyer's patch. This is a huge Peyer's patch right here. And this is, according to this down here, and I'm having to read this, this is the ileum. The ileum, you're going to have a lot of Peyer's patches. Okay, so B cells in here, T cells up here. And what antibody are being made by diffuse lymphatic tissue? IgA, secretory antibodies. They get secreted into the lumen. The lumen will be way down in this direction because this is the mucosal epithelium here. Here is another diffuse lymphatic tissue. This says it's in the colon. And you can guess it's the colon by this configuration right here, which are supposed to be called simple tubular glands of the colon. So you also see the simple columnar epithelia and these cleared out areas right here are goblet cells that you were supposed to learn about last semester. And we're coming back to them in the digestive section. So here's your Peyer's patch. This looks like a different histological preparation, using a different stain, different technician, and these are simple tubular glands. Okay? So you have simple tubular glands in two organs, either in the colon or your appendix. So if you're just looking at the mucosa of your colon and your appendix there, they look alike. Okay? In your colon and your appendix. And the way you can tell the difference between colon and appendix is that the colon has more smooth muscles than the appendix. So you have to look at other areas. But anyway, here is a Peyer's patch. Here's another one, bigger one. B cells, T cells. And what are we in? The appendix. Okay. And the appendix has more Peyer's patches per square inch than anywhere else with digestion. So they make a lot of secretory antibodies. Here's another Peyer's patch. This might be low power. This is high power. This is low power, the same image. Okay. And we're looking at slightly different area of the same diffuse lymphatic tissue. Again, diffuse lymphatic tissue because it doesn't have a capsule. What is this? Oh, Hassel's corpuscle. So we must be in the thymus. Okay, it's lobulated. Must be the thymus. Has a medulla and a cortex. And again, different maturation processes of T cells take place in the cortex or the medulla. And we'll talk about that in more detail later. Hassel's corpuscle. So this is probably a high magnification of the thymus. You will not see Hassel's corpuscles anywhere else. I don't know what that is. It doesn't look like a Hassel's corpus, but it might be. But in all likelihood, it's probably not, because this is a young adult, so, or very young. I would guess this might be a teenager. Lobulated. More thymus, Hassel's corpuscle. Looking at, I guess this is right here, is magnified. Is that right? No, just looks alike. This is a very young thymus, because I don't see Hassel's corpuscles. Maybe this might be one getting started. No Hassel's corpuscles, so this is probably very. This is infantile. Okay, another very young thymus. No Hassel's corpuscles. This is when you're really cranking out the T cells and natural killer cells. Infant. This is what an infant thymus looks like. This right here is an artery. Here it is under low power. No hapless corpuscles at all. These are the lacteals right here within the lamina propria, okay, of your digestive tract. The lamina propria is a connective tissue in these folds called macrovilli. And the microvilli, as you recall, is the brush border of your simple columnar epithelium, and all these cleared out areas are goblet cells making mucus. So the lacteals is where you absorb fat. So these are lymphatics, low power and high power of the same tissue. Now this area right here is this right here. It's just, this is upside down. This is the duodenum. You have more lacteal in the lamina propria, goblet cells, simple columnar epithelia, the lumen. This looks like central artery and germinal centers, thick capsule. And I'm not so sure what I'm looking at here, to be honest with you. I'm not reading anything, and I'm trying not to. I would have to look at this at higher power to be able to tell you if this is the spleen or a tonsil. But I'm looking at potential central arteries, so I'm leaning more towards the spleen. So this would be white pulp red. Higher power, the same thing, and definitely we are the spleen. Here is some white pulp and red pulp. Is that the spleen on this page? Yeah. Okay, so you have squamous epithelia forming the viscera, connective tissue. Okay, the viscera serosa is what it's called. And there's your simple squamous epithelia. Now the viscera serosa, I might add, is always simple squamous on every organ except one. Which organ is that? Your ovaries. It's simple cuboidal epithelium. Okay. It's unique, can I say. Central artery, terminal center, higher power of that central artery, we're definitely in this way. Surrounded by red pulp. So we're going to look at lymph nodes and tonsils now. Subcapsular space has to be a lymph node. Okay? Germinal centers. Looks like non-keratinized stratified squamous epithelia, germinal centers. We are in a tonsil. This is not a subcapsular space. Salivary glands. So this is the hilus of the tonsil, skeletal muscle. Salivary glands, if these are all the same, it's got to be a tonsil because it's the only place you're going to have salivary glands. Okay, so this has got to be non-keratinized stratified squamous epithelia, the germinal center, non-keratinized stratified squamous epithelia, two germinal centers, definitely a small tonsil. High power of the same thing. And that's it.